Gallstones are quite common, actually, although nobody really knows what causes them. There are several theories, but nobody knows for sure. They seem to run in families, although it doesn't necessarily mean there's a genetic basis for it. Many people will have gallstones their entire life and not know it. They can be completely asymptomatic. Why does one person with stones start having attacks and another person doesn't? Nobody knows. The demographics of gallbladder disease are pretty consistent over the years. We do see more gallbladder problems in women. There are theories as to why that is. Interestingly, during or after pregnancy seems to be a not uncommon time for women to start having gallbladder problems. Gallbladder surgery is in fact the most common operation performed in this country. Well over 1 million a year are done. In the Southeast, we sort of consider this the gallbladder belt. And so factors such as the high cholesterol or the high fat diet that we tend to eat in the South, diabetes also seems to be a risk factor for developing gallstones. It doesn't contribute to symptoms from gallstones, but people with diabetes seem to develop it a little bit more. Those are risk factors that make gallbladder disease quite common in the South. To the best of my knowledge, there are no preventative measures anyone can take to avoid gallbladder problems. Since we aren't exactly sure what causes gallstones and certainly don't know what causes a gallbladder to just become dysfunctional, we don't really have any way to prevent it. One thing that I do caution patients against are the internet-based cleanses that people may try. People may find that they have gallstones and want to avoid surgery, and so they try these cleanses, and I actually think that's dangerous to do. I would certainly advise anybody to not do that. What that can do, in theory, is cause you to pass a gallstone, and passing a gallstone can be a completely asymptomatic process. But if a gallstone happens to come out of the gallbladder and get into the main bile tree and lodge, that can give people some significant problems. You can have jaundice, you can have infection in the bile tree, and you can have pancreatitis. And gallstone-associated pancreatitis is something that we do see on a fairly regular basis, and it can be a very devastating disease.